She's provided care across general medical wards, emergency departments, oncology, and palliative care services. Reflective of her contributions and experience, she's also been a manager, a clinical nurse consultant, and a clinical nurse coordinator. Currently, she works in oncology and palliative care and is working as a clinical nurse consultant who is pursuing her master's in nursing and has been aided by a PaSCE Scholarship. In case I forgot, she's achieved all this while raising 3 children, and our conversation aligns perfectly with the Nurse Practitioner Week and the opening of PaSCE Scholarships for 2025. So please welcome Katrina Ellis.
Thanks so much for that very nice introduction, Tim.
Of course.
I'm very happy to be joining you today.
Yeah, thank you so much for your time. I thought just before we start off with some questions, Katrina, I'll give a bit of an overview as to what Nurse Practitioner Week is, just for anyone in our audience who isn't familiar with it or hasn't partaken in it. So, back in 1965, the University of Colorado created the inaugural Nurse Practitioner course, but it wasn't until around the 90s in New South Wales that the idea started to gain some traction. Nursing has always been a highly respected and highly regarded profession. If you look at most trusted professions or any surveys, nurses are always up there at the top. So it seems like a natural assimilation to move a very trusted profession, increasing some of their scopes to align closer with a general practitioner was going to be the benefit of all people. So by the year 2000, though, only 2 nurse practitioners were accredited. And by 2009, all states and territories had adopted legislation endorsing the enrolment and the training of nurse practitioners. And now to date, there's more than 2,200 nurse practitioners working across Australia.
Wow.
So, yeah. So my first question before you join number 2,201 is, can you remember the first nurse practitioner that you worked alongside?
Yes, it's my best friend actually, her name's Anne Booms, and she's been a nurse practitioner for 16 years now. Um, she actually inspired me to become a nurse practitioner. It's just how compassionate she is, her professionalism, and her compassion and passion to become a nurse practitioner and service the community.
So, given you have such a close relationship with her, what do you anticipate, or what has she told you that will change once you receive that qualification and you get that bigger scope? What's going to change day to day?
It's going to be obviously a lot more responsibility. You have to work in a collaborative relationship with all other professions for to basically coordinate the care of the patients you see to give them the best possible outcome. A lot of it is very good communication skills within that network that you develop as well. And at the end of the day, we're all working together to give the best possible outcome for the patients that we provide a service to.
Yeah, absolutely. And what about your nursing skills? Do you think that'll best transition into this role? What do you think that you'll be able to complement?
Um, I think over my 30 odd years, I've gleaned a lot of skills from all my different roles and areas, and it will help me in that transition to become a proficient nurse practitioner, especially my assessment skills, my communication skills, my leadership skills, and my coordination skills. I'm very much in my current role. It's very patient and family focused care, and it's almost coordination of care as well. So I hope and I assume that that will just flow on as I hopefully become a great nurse practitioner.
I'm certain that you will, given how much time you spent with such vulnerable people. I'm sure you have the communication skills in spades and you will complement that profession even greatly and be a great representative of all of us nurses. I wanted to ask, Katrina, given you studied in Perth and spent your first few years working in Perth Metropolitan, but then you moved up to the country for 16 years.
I did.
What drew you to the WAX region, and especially as a young nurse and as a young person? Um, and what do you feel like you're able to contribute to that community?
Um, I I'm actually a country girl, so I grew up in the bush. So I wanted my growing family to experience that as well. So it just was the right fit to live in 2J at the time. And um, Northern Hospital provided me with different roles, a different scope of practice as well. And my elderly parents were living in that area as well, so I could be closer to them and, of course, get some free babysitting. Um, and it was just a nice, close-knit community, which actually you have to have, I think, more wits about you in the bush. You've got to be a problem solver. You've got to think outside the box all the time. And that has helped me when I've come back to the metro area. And who knows what the future will hold. I may go back rural, but I definitely do have a plan how I could probably best serve people and the community for the rest of my nursing career.
And what about the country areas professionally um, attracted and retained you to it? I know that Northern Regional Hospital and most hospitals in country areas have difficulty retaining and recruiting staff. So, what advice might you give to someone who's thinking about going out there as to what will keep them there professionally?
I think you work in a more cohesive relationship with the professional network, like the doctors, the allied health. Most of them are your next door neighbours as well. Um, so you all band together and work as a collaborative team with the resources you have, and most of the time it's a lot less than what you have available to you in the metro area, and you do what you have to do up there to achieve the best outcomes with the resources you've got. Rural people are definitely at a disadvantage for access to the gold standard healthcare compared to metro area. So the more skilled, advanced, trained clinicians you can get to the rural areas, and especially if you have multiple roles or you've experienced multiple roles, then you're almost like a one-stop shop clinician. You can coordinate their care, you know straight away what the referral pathway should be, where they need to go, or who they need to see in terms of specialists, and you can help facilitate that for the person and be their advocate as well.
So, a bit more of a robust experience, I guess you could say.
Oh, definitely. It's not only do you have a professional's side to you as a clinician, but the people you work with become your friends, your neighbours as well. So you experience the needs of the community together, and you work together to help keep that community together and healthy as possible.
Beautiful. You become part of the town, town becomes part of you. I like that.
Exactly.
My next question, Katrina, is just regarding if we take a step back and you look at your career, you worked in general nursing, you moved into EDs, into chemotherapy, to oncology, and now into palliative care. There's a bit of a linear progression, I guess you could say, there in terms of if you can trust that against someone's life expectancy. So what has motivated you to move from acute care into more holistic and person-centered care?
I guess I've always been a people person. and that's probably what got me into nursing in the first place. And I've got a bit of a gift of the gab. So I I I just found that oncology people and a lot of cancer related diseases do transition into a palliative phase. I just felt that my skills could be most beneficial to that cohort of people. Um, I like to get to know the person, what makes them tick, basically. And once you develop that trusting rapport and get to their level and understanding, you can achieve so much more, both with their psychological health, their physical health, and you can help them along their journey wherever it takes them, whether it's they get remission or if it's end of life. And I've found it extremely rewarding to meet these people and their families and get to know them as a, as a person, as a human being.
Very nicely put. I like that. My last question, Katrina, is just around being a recipient of a PaSCE Scholarship. How has it supported you to pursue further education and training?
Tremendously. I wouldn't be talking to you today if I didn't get that support from you guys. Like finances are tight for everyone in the current economic climate, and um, it was a funny story, actually. I applied for the scholarship first in the 11th hour, it was, and then I was successful. Thank you very much to your organisation. And then I went, gee, I better follow through on this now,
A bit of pressure, yeah.
and then applied for the masters. So you guys were also a great motivating factor to do my NP. So thank you.
Of course, and thank you so much for Katrina for joining us for today, for being a recipient of one of our scholarships. We look forward to hearing about what you're going to contribute in the NP space in the months, years. So thank you so much for your time. This has been another episode of Keeping Up with the Pace. See you on the next one.
Thank you.